Should handpieces be sterilized by Repair.Dental? Handpieces, also known as dental drills, are essential tools in dentistry. These instruments are used to remove decayed tooth material, shape and polish teeth, and perform other dental procedures. Palisades Dental, Patterson, Safco, Siemens, Sirona, Yoshida, Dabi Atlante, Castellini are some of the famous dental handpiece brands. The importance of sterilizing handpieces. Handpieces come into direct contact with patients' teeth, saliva, blood, and other bodily fluids during dental procedures. These fluids can contain harmful microorganisms, such as bacteria and viruses, that can cause infections and diseases. Sterilization is the only way to ensure that all harmful microorganisms are eliminated from the surface of the handpiece, preventing the spread of infections between patients. The American Dental Association, ADA, and the Centers for Disease Control and Prevention, CDC, both recommend that dental handpieces be sterilized after each use. The ADA's guidelines state that handpieces should be sterilized using heat or chemical sterilization methods that meet the American National Standards Institute, ANSI, Association for the Advancement of Medical Instrumentation, AMI, standards. Failure to comply with these guidelines can result in serious consequences for both dental professionals and patients. Consequences of not sterilizing handpieces. If handpieces are not properly sterilized, they can become a source of infection for patients. The microorganisms that can be transmitted through contaminated handpieces include hepatitis B and C viruses, human immunodeficiency virus, HIV, and other bloodborne pathogens. These infections can lead to serious health consequences, including liver disease, immune system disorders, and even death. In addition to the risk of infection, failing to sterilize handpieces can also result in regulatory and legal consequences for dental professionals. State and federal regulatory agencies require dental offices to follow infection control protocols, including sterilizing handpieces after each use. Fines, license suspensions, and even criminal charges may follow non-compliance with these rules. Methods of sterilizing handpieces. There are several methods of sterilizing handpieces, including heat sterilization and chemical sterilization. Heat sterilization involves using an autoclave, a machine that uses steam under pressure to kill microorganisms. Handpieces can be sterilized using either a pre-vacuum or gravity cycle. In the pre-vacuum cycle, the air is removed from the chamber before steam is introduced, whereas in the gravity cycle, steam is introduced into the chamber and then gravity removes the air. Both cycles are effective at sterilizing handpieces, but the pre-vacuum cycle is faster and more efficient. Chemical sterilization involves using liquid or gas sterilants to kill microorganisms. The most commonly used chemical sterilant is glutaraldehyde, which is a high-level disinfectant. However, glutaraldehyde requires a longer contact time than heat sterilization and can be hazardous to dental professionals if not handled properly. In conclusion, sterilizing handpieces is essential to prevent the spread of infections and diseases in dental offices. Failure to sterilize handpieces can result in serious health consequences for patients, as well as regulatory and legal consequences for dental professionals. Heat sterilization and chemical sterilization are effective methods of sterilizing handpieces, but dental offices must follow the recommended guidelines and standards to ensure that all harmful microorganisms are eliminated. By prioritizing the sterilization of handpieces, dental professionals can provide safe and effective care to their patients while maintaining their reputation and compliance with regulatory requirements. For any handpiece repair, contact Repair.Dental. Thanks for watching. Like, share, and subscribe for more dental repair tips. Visit Repair.Dental for your dental equipment needs. See you next time.